Let's turn it up.
Relax and unwind because we're going live.
91.7 Wave FM.
Thank you very much for staying with us right here on Rave 91.7 FM over the Fine. Your moment to bring you beautiful music, amazing music, spice it up as always with quality talk. My name is Femi Olanipekun, welcoming you on board Frank Talk, where we take a look at trending issues and the polity. We bring these issues closer to you, help you have a better understanding, deeper insight into the issues in our polity, with a view to raising the level of public discuss, preferring solutions to challenges I might be facing as a nation and as individuals. Well, we look at politics and we look at policies. Today, we'll be looking at some field of science and how we can apply that really to issues bedeviling our nation as of today. A group of scientists really, and what they do, how their skills could be deployed to the advantage of our dear nation, Nigeria. I'm joined in the studio by leaders of the Nigerian Association of Clinical Psychologists who are in Oshogbo for a 5-day workshop, really looking at how to better their own profession, better their own lot, and update themselves as regards their profession and career here today. My name Femi Olanipekun once again. I will introduce my guests to you shortly, but then they are here to have a 5-day workshop on assessment and treatment techniques in clinical psychology practice. They are members of the Nigerian Association of Clinical Psychologists. So it seems it's a continuing education stuff really, and that is one commendable one that we should all do. All association should be involved in. My guest this morning, Professor Helen Oshinowo, is a professor of clinical and forensic psychology, and she is the chairman. She is the immediate past vice president, Nigerian Association of Clinical Psychologists. So thank you very much for joining us this morning on Frank Talk.
Thank you very much. I'm happy to be here this morning.
All right, thank you very much.
I'm the chairman of the Continuing Education Committee.
All right, okay. For this particular program.
For this particular program.
All right, thank you very much. My other guest this morning, Professor Benedicta Yetunde Oladimeji. She is also a professor of clinical psychology at the Femi Awolowo University, Ile-Ife. Thank you very much for joining us, on Frank Talk this morning. And I'm also Dr. Olugbemi Olukolade. He is also a clinical psychologist at the University College Hospital, Ibadan. Thank you for joining us this morning on Frank Talk.
Good morning.
Good morning. Well, let me start with Professor Benedicta Yetunde Oladimeji of the Femi Awolowo University, Ile-Ife. Well, we are in a special period in our history. Let me look at what efforts and what roles you can play as clinical psychologists in the Nigeria of today. Now, two major words interchanging in the Nigerian political sphere. We have change and we have recession. Now, let me start with recession. What roles can clinical psychologists play helping the average Nigerian at this particular point of recession?
Well, clinical psychologists can play many roles. For example, in this period of recession, we have heard of cases of people committing suicide or thinking of committing suicide. And it is in our area as students and practitioners of behavior and behavioral changes to try to create awareness and get people to look at their problems from different perspectives. Suicide is not the solution to this economic recession. And we need people to be able to think positively and act positively too, to see them through this period of recession.
Okay. Well, I will come back to you, Professor Oladimeji. You are actually the president of the Nigerian Association of Clinical Psychologists. Let me get to Professor Helen Oshinowo now. One other topic in our political sphere is about change. In fact, the federal government started a program not long ago about a change begins with me campaign. Can clinical psychologists play any role in these?
Thank you very much. We as clinical psychologists have studied the scientific study of the mind. And in terms of change, individuals have to be prepared to accept the roles that they have to play in ensuring that change is effective. And we start this from the home. As families, family is the primary agent of socialization. We have to ensure that we teach our children, ward and family members on being able to plan effectively for all the problems that we have in Nigeria in terms of recession, in terms of unemployment, how individuals have to ensure that they could be involved in entrepreneurship. This will provide income, no matter how little it is, for individuals to get by. In terms of corruption that we're experiencing in Nigeria today, it is not wise for our politicians or individuals in various government offices to continue to amass the wealth that should be spent for others in the society. Hence, we as psychologists can create awareness to the fact that we should not be involved in corrupt practices. At the moment, the government of Buhari is trying, our President Buhari is trying to ensure that those who have been involved in these corrupt practices are being made to be investigated and curb this activity. And that will go a long way to deter others who may be thinking of such activities. In Nigeria, we know that as psychologists, we use behavior modification programs, cognitive behavioral programs, to change or restructure the mindset of Nigerians so that we can think more positively on how Nigeria can move ahead. Nigeria has a lot of wealth. The wealth that could assist the country to develop. But unfortunately, we are not ready to accept the thriftiness and taking responsibility for our actions to ensure that Nigeria does not go to the doom.
All right. Okay. Let me get to Dr. Now, you also are a clinical psychologist. Before I return to the president and ask about this particular association itself and what people seems not to know much about it, but then you've heard about this, Jade Knight. She was talking about mindset the other time. As a Nigerian, you've been around, you've seen people react positively and negatively to messages of government. This particular campaign, the Change Begins With Me campaign, how do you think Nigerians have so far received it? And what informs the mindset as regards the reaction to it?
Well, Nigerians have reacted to the change program by the current administration with mixed feelings. Some people are of the opinion that it's just like what the other past government administrations have been talking about, while others believe that it's time of change. And that is naturally the way humans, how we react to anything that is being given to us. And that's what we as psychologists, what we do, that we try to help people to understand what the government is talking about, what like this change program, if psychological approaches are involved in it, so that the change, it becomes our the thing that we want to do. It becomes a belief from us, not by a force that is being projected to us, that it becomes like a belief that we have in our mind, that this is our project, this Nigeria is like a personal project that we have. And we have, if we can use psychological paradigms, approaches to instilling change in people, which is that it is what I want to do, this is what I can live for, this is what I can die for. You know, like the American way of doing things, that people believe that this is my country. Wherever they get to, they want to be like that. They want people to see them as an American. We can actually have the kind of change program in our mindset that makes it that I'm a Nigerian. I want to live for Nigeria. I want to do things for Nigeria.
Okay. Well, Professor Oladimeji, as the president of this association, the Nigerian Association of Clinical Psychologists, many people don't really know much about clinical psychologists. Why is that?
Well, relatively, we are new on the field, and but we've been, at least the association has been around since around 1979. But we are very few in number. We were, until the 80s. We were just about 5 practicing clinical psychologists. But with the training programs that have been introduced, we now have quite a number of clinical psychologists in various fields, working in various settings. We have in our hospitals, that's where we started, but we are extending our tentacles, to prisons, to schools, and different areas. Well, because of the hospital location that we started from, so people tend to associate us only with mentally ill people and so on. So, but that's why we are now moving out.
Do you really function outside of the hospital environment, outside of the mentally ill?
Yeah, we do function. In those areas, like, for example, even in the army, we have psychologists there, assessing, treating people, organizing programs for the army people, especially in terms of stress inoculation, and in other areas too.
away from the army, from the hospital.
Yes, hospitals.
You function in other aspects of, of our national life.
Yes.
Too. Okay. Well,
the pity is that there are many issues that we feel we should be involved in, but psychologists are not reckoned with. Even, take these times of trauma and disasters. Several times we have made efforts to reach out to those in NEMA, those in the ministry, that we should be involved in the rehabilitation of even the children kidnapped by Boko Haram and so on. But what happens? We write proposals and they hijack it. They give it to English majors and so on. This happened even just last year. So we have been trying to let people be aware that, look, you need psychologists to be involved in this that you are doing. But most of the programs they are doing, they just hijack it to make profit, and they don't really reckon with those. They say we are terrorizing and so on.
Okay. Well, let me get to Professor Oshinowo now. Let us know. Nigerians will be interested in knowing what you really do in the line of patient management.
Thank you very much. I want to start by saying that clinical psychologists are members of the multidisciplinary team, which comprises of the medical doctors, the nurses, the psychiatrists, the medical social workers, and also the occupational therapists. We receive referrals regarding individuals suffering from psychological problems. And there are several areas. Clinical psychology is not synonymous with psychiatric services. We have clinical health psychology. In our midst here, we have Dr. Oladimeji, who is a clinical psychologist, the first employed in University College Hospital. And he attends ward rounds. I have been involved both in Nigeria and abroad with ward rounds. And what do I mean by ward rounds? When patients are in the hospitals, in the various wards, we participate in meetings that we call ward round, going from one patient to the other to discuss and address the problem that they are going through. We do clinical assessment, and we do formulation. In the process of doing clinical assessment, we identify the patient's problem, and we have specific techniques of doing this, using clinical interviews, just like the other members of the health team would do. But we have our own specific objective tests and projective tests that we also use as part of the clinical judgment to arrive at a diagnosis and formulation so as to make sense of what is wrong with the patient. And we now plan treatment. And we have various types of treatment based on the various psychological models, starting from psychoanalysis, the cognitive, which is a psychodynamic model, depending on the kind of problem that the person is experiencing. The clinician will decide on which option to use.
Okay, so you play a very major role, a key role in patient management.
In assessment, patient diagnosis and formulation, and treatment. And that's why I'm saying that we have various models. We have the cognitive behavioral approaches, the rational behavior emotive therapy, which is humanistic, and we use behavior modification, whereby we can find out what the problem is. Behaviorally, we would have observed what the issues are, and if we need to identify some childhood experiences or environmental factors that led to the problem, we address these issues and we point them out at the various case conferences, ward rounds, and also both inpatient and outpatient treatment, even drug abuse problems. We participate in the management of such patients.
Okay, now, Dr. Olukolade, there's been a rise in cases of suicide, cases of rape. One would ordinarily think, is this a failure on the part of psychologists?
No, not at all. It's not a failure on the part of psychologists. It's a problem. It's a human problem, and like psychology is the study of the human mind, people. Now, is the problem on the part of the society, not on psychology. However, we have actually been working with patients, with people that has this kind of problem, that has suicide, or that, and one of the things that we do actually is understanding and nipping it in the bud before a person commits suicide. That means that we are, like Professor Shino has said, we are involved in looking ahead and seeing if a person has the propensity of committing suicide. Now, we are able to do risk assessment immediately. We say a person, and be able to say that this person, there is a possibility of committing suicide. Now, we don't stop there. After our assessment, we try as much as possible to quickly put a program in place so that the person do not commit suicide. And in suicide, when suicide tries to occur, when the person wants to commit suicide and the person do not commit suicide, we play a large role, because the suicide is not something that you just use medications to treat. Now, it comes about the mindset. It comes about the way I'm thinking. It comes about my hope for the future. It comes about my plan. It comes about what the meaning I give to my life, the meaning I give to what has happened to me in the past that is causing my premeditated suicide. So these are the things that psychologists, as we play, the role that we play in actually dealing with suicide.
What about the cases of rape?
And also in cases of rape, now it's a dual pronged thing for us, in that we try as much as possible to help the person who has been raped by, first, like we said, one of the major things that we do is assessment. So we assess the individual to know is the person having any psychopathology, and most of the time people who have been raped, they have something called a post-traumatic stress disorder. Now, we treat that by using so many psychological, depending on the individual. We use psychological approaches in treating that. Then also, for the person that has committed this crime, now there needs to be a change of orientation on the part of the perpetrator of this, which many times we don't look at critically. Many times people just take them to the prison or take them to the police, and they take them to court, they charge them, and the person is taken there. No rehabilitation per se for the individual, which is the perpetrator, because if we don't do anything about the person that has committed this crime, then there's a possibility of a reoccurrence. So we work on the two. We work on the person that has been raped. We work on the person that perpetrated the act. Those are some of the things that clinical psychology.
Okay.
If I may comment, sir.
Yes, please do, ma'am.
Concerning that issue of suicide, the society is trying to put on a program of creating awareness in the public, because suicide, we are not the people to know, but we want people near people to be able to recognize the signs of suicide, that this person, and not just gloss over it, to be on the lookout and know what to do.
What are those signs that predisposes in a person that think that this person has a tendency to commit suicide?
No, there's no signs that says this person has a tendency, but there are signs to say that this person may resort to suicide. Sometimes they say it, I'm fed up of this life. And we just say, are you okay? Fed up, like that, we should be able to encourage the person to speak out, to express himself, why, and not just dismiss the person or what he has said. Because we may think he's not serious, but he is serious. And if we don't nip it in the bud, he will go ahead and do it. Even recently, we heard of somebody thinking of committing suicide. Fortunately, people arrived and they said why. Said because he has heard they are going to retrench at his place of work. They have not even retrenched him, but he was ready to, he was already making plans. So that kind of person, we usually we say, just make fun and so on. But the person needs to be helped. And we want people around to know when to encourage people to speak their mind, to know what to say, not just to tell people, don't think about it. That's a foolish thing to do and things like that. But to help the person to get over that way of thinking and take the right steps to the solution of the problem.
Okay, well, just before I get to Professor Shinawo, just to ask, I'm curious, is there a difference between psychology and psychiatry? Psychiatrists and psychology, people tend to mix the two together. What's the difference?
Yeah, there is a difference. Psychiatrists are medical doctors that have now specialized in the treatment of managing pathological behavior. And their main armamentarium are drugs and medication. Now, we are people who started with the study of normal behavior, went on to specialize in how to apply the principles of normal behavior in the setting of pathology. And so we are regarded as talking doctors. We don't give medication, but we talk the person through. We use various means to get the person to ventilate, to change their ways of thinking and so on. And it's been found to, sometimes it's enough, but most times if joined with the medication and so on, it makes the intervention more effective.
Well, let me come to the chairman of this continuing education committee, setting up this 5-day workshop here in Oshobo. Professor Shinawo, tell us more. Why really are you able to have this workshop in the first place? 5-day workshop with the theme assessment and treatment techniques in clinical psychology practice.
Thank you very much. As far as the continuing education is concerned, the Association of Clinical Psychology and the National Psychological Association have for a long time felt the need for us to continue to update our knowledge and practice so as to be able to handle conventional issues, contemporary issues, like you've been talking about the issue of increase in suicide, increase in rape. Some individuals are trained in a particular model, depending on the school of thought. But when we come together, we can discuss several areas that people can benefit from so as to improve their professional skills wherever they find themselves. Many of us may have trained in family therapy, and we bring such knowledge and skills to others so that they will not be found wanting in the places where they work. Recently, a student of mine, in collaboration with me, identified self-harm within the prison system. Because the prison authority discovered that there was a lot of violence, there was a lot of anger, there was a lot of suicide ideation and suicide cases in the prison. So there was need for this individual to develop a protocol to assess such people, especially those who have been found to be showing signs of depression for a long time within the prison system, either as a result of the genetic loading, that is, they may have the propensity to develop some psychopathology, but the prison system, as it is a stressful environment, will now act as catalyst to bring about this suicide ideation. So when we are able to use our clinical assessment method to identify such individuals within the prison, we can help the prison workers to identify such people within the various wards or cells who are showing such signs.
So you're coming together here to rub minds together, and then help one another,
improve our skills, and also the younger ones in the profession can benefit from the older colleagues on ways to improve their practices, because we don't want to be found wanting in the area of knowing the right form of assessment tools to use. Some are current, some are being updated, some are being re-standardized, because at times there are some foreign tests that are developed. But we have to teach the younger ones also to know how to either develop new ones or demonstrate the reliability of such instruments within our own culture.
All right, Madam President, you'd like to add to that, why this is coming up at this time, this 5-day workshop here.
Yeah, actually, we started this program from 2011. We've been doing it every year because we realize that people from different centers are trained differently, and we felt the need to streamline some of these trainings and also to fill in the gaps. For example, many centers, due to the economic situation, we don't have the necessary current equipment. So by coming together, we show them the current ones and teach them how to use it. Then they can go back to their centers to request for them. And, when they come, they know how to use it. They know what to do. Because before we were having complaints that I have a clinical psychologist, he doesn't know what to do when you. So that's why we started, and to fill those loopholes, so that our people, wherever and whenever they are called upon, they know what to do and how to do it.
It started yesterday. When is it ending?
Friday.
Friday?
Yes.
Where is it holding?
We are holding it at the Ripples Hotels on Oroki Estate.
Okay. To Professor Oshinowo, is this open to all members of the public or only registered members of the association? And then is this free? Just to come and benefit from what is happening there?
Well, I can.
Yesterday was free.
I can observe my president smiling. If you were at that venue yesterday, I'm sure you would have realized that the protocols put in place were of international standard. The preparation was at its highest level, and which costs money. As an association, we are still trying to find our feet, but a levy of 15,000 was prescribed
For students?
Students, and 30,000
25?
25,000 is the fee, the workshop fee for members. But within this money, preparation has gone towards the conference bag and some materials. And this money is not actually enough. We have had to levy ourselves to be able to put this program together. And for a period of 5 days, it is out of this bill that we have to feed members. And this is quite expensive. So I must say that having to pay for the hall and meet all the necessary expenditure has been borne by some members of the executive committee, and we are doing this as sacrifice for the association because of the enormity of responsibility placed on us.
All right, okay. Dr. Olukolade, Professor Shinawa and Professor Oladimeji talked about, these open to members of the association and then also to students who are actually master's students now. What about undergraduate students? Is this open to them also?
Well, it's not.
Not at the moment.
At the moment, because at undergraduate, you are not yet a clinical psychologist, and it's much more a decision that you might and you might not. But if undergraduates are interested, I'm sure that the association will find a way of bringing them in to increase their desire to become a member of clinical psychology.
Just before we open the lines now, I'm going to ask you, what time of the day exactly is it holding?
It's holding from 9 a.m. to 5 p.m. daily.
Okay, all right. Well, we open the lines for you now. I'm going to ask Dr. Olukolade one other question about the de-radicalization policy of the federal government for repentant and captured Boko Haram members. Some people have said that it's not feasible, it's not practicable, but then I've had some psychologists say, well, why not? It's possible, and reintegrating them back into the society. But that will be after we open the phone lines now.
You can now join the conversation by calling 0703-175-9177, 0703-175-9177, and 0902-427-3808. You can equally make use of our social media platforms. For WhatsApp, 0703-175-9173, 0703-175-9173. Tweet at us at Rave917FM, and Facebook is Rave917FM. Do remember to turn down the volume on your radio set or move away from it. And please, let's keep our comments civil. Thank you.
Hello, good morning. Thank you for joining us.
Yeah, good morning. My name is Dr. Speaker from Togo.
Thank you very much.
I want to contribute to the program going ahead presently. My contribution is that the both people, I mean, your invitees are spoken well, but the main problem we're facing in Nigeria is that the change of mindset is what we are lacking. Until we change our mindset, then we can make progress in the country. That's my contribution now.
All right, thank you very much. You can also join us on our social media platforms, on Twitter, on Facebook, and of course on our WhatsApp. And another call coming in at this moment. Hello, good morning.
Hello, good morning.
Thank you for joining us.
My name is Bode. I'm calling from Ife.
Thank you very much, Mr. Bode.
I want to commend our speakers, our psychologists who has come on the program this morning. I never knew the association is on ground. And if I thought the association has been in existence since 1970, whatever the guest said, the association has been in existence, I think in the area of politics, they have not been functioning. Because if you look at our politicians today, there is a need for psychologists to, psychoanalyze them before going into election. You see, many of our politicians today, they are pathological liars. Before coming to election, psychologists ought to have, psychoanalyzed them, bring that psychological examination for people of the masses, for Nigerians to see that, okay, is this person, reliable for me to cast my vote for? I get to me. So I want our psychologists to work very well on that.
All right, thank you very much, Mr. Bode. Let's take some messages on our WhatsApp platform, or we allow our guests to react to that, especially the comment by Mr. Bode from Ife. Okay, Professor Shinawa, saying, is your association playing any role, or are you willing to play any role in politics, maybe assessing a political leaders or political contestant before they get to office?
Thank you very much for that question. You will agree with me that some time ago, in Lagos State, there was this idea muted about assessing individuals who have been driving on the wrong side. But we have also mentioned that we are not sure whether the people who are involved in corrupt practices realize the negative impact on the society. And now this is beginning to show. We are not happy that when we are watching the television, we see our politicians involved in workplace violence. We target workplace violence because they have been hitting each other with chairs. These are supposed to be our elders in the society, and children are watching. Youth are watching. Other adults are watching. This type of modeling is of negative type. They need psychological assessment. The electioneering processes that we have observed in Nigeria requires that people, even at grassroots level, are educated.
All right, sorry to cut in here, but we have another call. Hello, good morning.
Good morning. My name is Mayowa. I'm calling from Marital Oshobo.
Thank you very much, Mr. Mayowa.
Please, I really want to appreciate you for the program of this morning. It's a very good one. I just have some questions for the guests in the house this morning. I don't know with the economic situation of the country, with everything that is happening in the country now, we have a lot of people that they are depressed. We have a lot of depressed people walking around in the city, so they don't have anybody to help them there. So I don't know the awareness that can be made to such people. Once we reach out to such people, it's not everybody that listens to radio program like this, and it's not everybody that can attend the seminar. So there should be a way of reaching out to those people, maybe something like branding some TV program or something in the paper. How those people will be helped. That's just what I want to say. Because we have a lot of depressed people walking on the street. We almost, every citizen of this country now, they are depressed because of the economic situation. Some people indulge in the kind of habit they didn't supposed to do, but they will tell you because of the situation in the country. So I don't know how our guests in the house can really please help those people.
Okay. All right. Thank you very much. Before we take the next call, Dr. Olukolade should respond to that.
Yes, as clinical psychologists, one of the things that we have been doing in our various centers is that we try as much as possible to let people know what we are doing, and that there is help available for people. And one of the ways that we do that is that frequently in different centers we try as much as possible to do seminars. We have pamphlets that we spread around.
Is there a need to work with government to make these more pronounced?
Yes.
Make it more public so they can reach more people?
Like the president said the other time, we've been writing a lot of proposals, trying to greet the government. Even like the question that you asked Professor Shinowo, one of the things there is that we cannot just say that we want to do assessment for politicians. It has to be in the law that they must have this assessment. For example, it's going to be very difficult for us as an association to say that we want to do personality assessment for politicians. If in the high neck procedure, they say that they must go for psychoanalysis, then it makes it important for us to do it for them. But if they just say that do psychological, not psychoanalysis, psychological assessment. Now, if they have not told us, then there's no way we can't just force ourselves on them and say
is the association pushing for such.
I'm telling you that
the making efforts,
making serious efforts.
Excuse me, I don't know, but I don't think we want to bastardize our profession. We don't want the profession to become an object of ridicule. Now, if you say you want to go to the house and you are sent to me for assessment, and I say that this person is a pathological liar from my findings, who is going to use it? How are they going to use it? You know, and I mean, it's not a question of assessment. And I think this thing goes beyond individuals. It's the society that needs radical change.
All right. Okay. Let's take the next call. Hello, good morning.
Hello.
Thank you for joining us. Where are you calling from?
Thank you.
Your name again, please. Okay.
I want to commend the people in the studio there. And this time I want to share as a man of God. Here the people in the as a profession are just want to attract people in the house also to be placing the good message. Message of hope that will help people, that people the hope. Message that will help people to know God. If the people know God, they will think rightly.
All right.
So they will not do the wrong thing. So this is my contribution. Thank you.
Thank you very much. Well, just before we go now, Dr. Olukolade, I was going to ask you, I asked you the other time about this Boko Haram de-radicalization of the members and, reintegration back into the society. Do you think it's feasible? Is it practicable?
Yes, it's very much visible and it's practicable. And one of the things that will make it visible and practicable is the involvement of clinical psychologists in this de-radicalization.
From my own research, I spoke with psychologists in Abuja, and they are currently involved in the de-radicalization program. But the only problem is that because these are classified individuals, the activities of the psychologists are not publicized. But we are involved.
You are involved.
We are involved. We also have an area called political psychology, where we use our knowledge to create awareness at the grassroots level about the personalities of this godfatherism, and also to ensure that the people do not get involved in electoral violence. So we have a role to play.
What you're in the way. It seems you favor to play more in the background than stay in the limelight. Is that anything in relation to your profession?
No, we are not looking for cheap popularity.
We are not looking for cheap popularity. But what we are saying is that we get involved in awareness programs along with some non-governmental organizations. They invite us to talk about these issues. Even we render these humanitarian services. When flood is this warnings about flood, we teach people about early warning signs, even for depression, for various psychological problems. when individuals know about this warning signs, which we have gone to mechanic villages, we have gone to markets to create awareness.
On your own,
yes,
or in collaboration with government or with the agencies?
On our own and with NGOs and even people in the Ministry of Ministry of Employment and Directorate. Some colleagues who are psychologists in the ministries have invited us to come and teach entrepreneurship skills to youth, so as to solve this problem of unemployment when they are able to gain some independence and autonomy. We call this self-efficacy in psychology, knowing what to do at the right time and having the skills to develop oneself.
All right. Well, thank you very much. Just before I go, I should ask the president. There is this rivalry amongst health practitioners now, nurses, doctors, pharmacists. Is there such also with psychologists, clinical psychologists in a hospital environment?
Well, to the glory of God, so far, those of us in practice, we have managed to maintain cordial relationships with all the people that we work with. In fact, we emphasize this in training. Yesterday, especially, we had this session teaching our younger colleagues that they must establish good rapport with the people they work with. They must be able to work as members of health teams or whatever teams they find themselves in. So, of course, we have issues like we don't have a salary scheme, a salary structure, and so that our people are not rightly placed in many places as far as salary scale is concerned. But we are working on that with the ministry. We are working on that, in the relevant agencies.
All right. All right, thank you very much. My guest this morning, I've been in the midst of shrinks this morning.
No.
Well, that's what psychologists are called also, I think. They are called shrinks who help us to manage our, behaviors better. They study us for the normal behavior, and then some people also say they study our abnormal behaviors as well. But an eminent psychologist with me in the studio this morning, Professor Benedicta Yetunde Oladimeji, the president of the Nigerian Association of Clinical Psychologists. We thank you for coming this morning on Front Talk.
Thank you for having us.
Professor Helen Oshinawo is a professor of clinical and forensic psychology. She is the chairman of the Continuing Education Committee of the Nigerian Association of Clinical Psychologists. Thank you very much for joining us.
Thank you very much. I gave an inaugural lecture recently on the role of psychologists in the health setting and also the criminal justice system. So we just don't work only within the health
hospital sector.
We also assist the police, the judiciary with advice, training of police officers, and also the lawyers.
So your work cuts across all facets of human life. Thank you very much. Also, Dr.
We need a council. We need a council.
All right.
We are appealing to the National Assembly to create the Psychology Council of Nigeria.
All right, okay.
Thank you, sir.
Thank you very much for coming, man. Also, Dr. Olugbemi Olukolade, a clinical psychologist with the University College Hospital, Ibadan. Thank you very much for joining us this morning. Also, Frank Talk. Well, to you there, listener, we appreciate you too for being a part of our world here today on Frank Talk on Rave 91.7 FM on behalf of my team and the executive producer, Femi Adefila. My name is Femi Olanipekun. Thanking you so much for listening and asking you to have a fine day.